Ms. King, I've looked at that place on your back that you're concerned about, and I'm pretty sure it's melanoma. I'm not 100% sure, but I will be meeting with some other dermatologists/pathologists this evening to look at slides, and we will be looking at your slide to confirm my suspicion. This is an excerpt of a conversation that I had with my dermatologist about 10 years ago. How many of you worry about being diagnosed with cancer? How many of you have been diagnosed with cancer or know someone who's been diagnosed with cancer? Cancer is the uncontrollable division of abnormal cells that can invade other tissue. Just hearing the word cancer makes many people uncomfortable. According to the Center for Disease Control's website, in 2010, cancer was the second leading cause of death behind heart disease. The good news about cancer today is that we know so much more about early detection and steps that you can take to minimize your risk of a cancer diagnosis, thanks to many years of research. Today, I'm going to be talking to you about skin cancer, colon cancer, and breast cancer. I want to talk to you about these tests for early detection, as well as steps that you can take to minimize your risk for one of these cancer diagnoses. I want to persuade all of you to see your doctor on a regular basis and to schedule these tests when they're prescribed. Contrary to this picture, you can prevent cancer by taking steps to reduce your risks. I know that many of you want to hear the rest of my melanoma story that I just started. Unfortunately, I did have a melanoma on my back. After the diagnosis, I was sent to a plastic surgeon who removed and analyzed more skin to make sure he had clear margins, which means that he got all of the cancer. Fortunately, he feels that he got all of the cancer. The first type of cancer that I want to talk to you about is skin cancer. According to the American Cancer Society website, skin cancer is the most common of all cancer types, as shown by my slide. There are 3 types of skin cancer, with melanoma being the deadliest form. We are all exposed to sunlight on a daily basis. Our bodies need that vitamin D that we get from the sunlight. However, too much sunlight on unprotected skin is not healthy and can be dangerous. According to the American Cancer Society website, most skin cancers are caused by the sun's UVA and UVB ultraviolet rays. If you find that you're going to be outside for an extended amount of time, there are a few things that you can do to minimize your risk of skin cancer. First, use a broad spectrum sunscreen with a sun protection factor, or SPF, of 30, and minimize your exposure to these rays during the times of 10 a.m. to 4 p.m. daily, when these rays are the strongest. Another thing that you can do to minimize your risk is to cover up your exposed skin by wearing special clothing, a hat, or sunglasses. It's important for you to be aware of the changes going on with your skin and to see your doctor to address any of these concerns. Contrary to popular belief, tanning beds do not keep you from getting skin cancer. In addition to the melanoma that I had removed, I've had quite a few of the other 2 types of cancers removed. I see my dermatologist twice a year for a full body check, or sooner if I have concerns about any changes that I've seen in my skin. I try to avoid going out in the sun, but if I find that I have to be out in the sun, I do use the broad spectrum sunscreen with the SPF of 30, and I wear a hat and sunglasses. If you notice any changes in your skin, it is very important that you go and see your doctor right away so that things can be done to correct these changes if needed. The second type of cancer that I want to talk to you about is colon cancer. According to an article on colorectal cancer on the National Cancer Institute website, colorectal cancer is the second leading cause of death from cancer in the United States, as shown on my slide. A colonoscopy is a diagnostic tool that doctors use to look for growth in the colon. This test is usually not recommended until a person turns 50 years old. The procedure itself takes about 30 minutes, and the patient is usually given medication to help them relax or go to sleep. If no growths are detected, the person usually does not have to go and have another colonoscopy for 10 years. I have had a colonoscopy done, and I was given medication to make me go to sleep, and I don't remember a thing. It's really important that you get this test scheduled as soon as your doctor recommends that you have one and not put it off. The colonoscopy is a way for doctors to find growths that could turn into cancer before any other symptoms appear. The third type of cancer that I want to talk to you about is breast cancer. According to the Center for Disease Control, breast cancer is the most common type of cancer found in women, aside from some skin cancers, as shown on my slide. Men can get breast cancer. A mammogram is a screening that can be done to detect changes in the breast before any other symptoms appear. According to the CDC website, doctors recommend that people have a mammogram done every other year, every 2 years, from age 50 to age 74. My mother has just turned 80 years old. When she was 75, she decided that she no longer needed to have a mammogram done. A friend of ours, who's also a doctor, told her she needed to continue to have the mammograms done, so she did. When my mother was 77, she was diagnosed with breast cancer. The breast cancer was detected in her annual mammogram. Like with the skin cancers, it's important for you to notice changes in your body. Many doctors also recommend that women do a monthly breast self-examination to also detect any changes that could be happening in the breast. Some other things that you can do to minimize your risk for breast cancer diagnosis is to get enough sleep, maintain a healthy weight, and exercise on a regular basis. The mammogram is an early detection tool that is used to find the breast cancer before any other symptoms are present. There are a couple of things that I want you to think about and remember about what I've just shared with you about cancer. We all live in fear of being diagnosed with some form of cancer. Today, I've talked to you about skin cancer, colon cancer, and breast cancer. I've talked to you about tests that you can have for early detection, as well as steps that you can take to minimize your risk. It's important for you to be proactive with your health. Won't you think about what I've said to you today and discuss your risks with your doctor? We need to minimize and decrease the cancer statistics. Please help reduce the cancer statistics by being proactive with your health. Remember, you can prevent cancer by taking steps to minimize your risks.